Most students try to memorize the pharynx and forget it during exams. Let's fix that in under 4 minutes. The pharynx is a muscular tube located behind the nose, the mouth, and the larynx. Now, what does that mean? It means your body uses one shared passageway for both air and food. Yes, same road. Quick structure before we go deeper. The pharynx has 3 parts and 2 groups of muscles. If you understand that, everything else becomes easy. Location and extent. The pharynx starts from the base of the skull and ends at the lower border of the 6th cervical vertebra, then continues as the esophagus. It lies behind the nasal cavity, the oral cavity, and the larynx. So everything you breathe and everything you swallow passes through here. Divisions. Now the most important part. The pharynx is divided into 3 sections. Remember this. N-O-L. First, the nasopharynx, located behind the nose. Function respiratory only. Only air passes here. It contains the adenoids and the openings of the auditory tubes. So when the adenoids enlarge, breathing through the nose becomes difficult. Next, the oropharynx, located behind the mouth. This is the crossroads. Both air and food pass here. It extends from the soft palate to the upper border of the epiglottis. It contains the palatine tonsils and the back of the tongue. So when you hear tonsillitis, this is the region involved. Finally, the laryngopharynx, located behind the larynx. Its job is to direct food into the esophagus. Here's the key idea. Food goes backward, air goes forward. If this coordination fails, you choke. So yes, this part is critical. Muscles, fast, clear. Now muscles, keep it simple. 2 groups, circular muscles and longitudinal muscles. Circular muscles, they are superior, middle, and inferior constrictors. Longitudinal muscles do the opposite. They lift the pharynx upward during swallowing. They include stylopharyngeus, palatopharyngeus, and salpingopharyngeus. So one group pushes, the other lifts. That's swallowing. Nerve supply. Now nerve supply. Main network, the pharyngeal plexus. Motor supply is mainly from the vagus nerve, but one exception, stylopharyngeus is supplied by the glossopharyngeal nerve. Sensory supply, nasopharynx, maxillary nerve, oropharynx, glossopharyngeal nerve, laryngopharynx, vagus nerve. Each level has its own nerve. Blood supply. Blood supply is straightforward. Arteries come from ascending pharyngeal artery, facial artery branches, and maxillary artery branches. Venous drainage, pharyngeal venous plexus to the internal jugular vein. Lymphatic drainage. Lymphatic drainage, nasopharynx, retropharyngeal nodes, oropharynx, jugulogastric nodes, laryngopharynx, deep cervical nodes. Clinical short but smart. Now clinical connections. Tonsillitis, inflammation in the oropharynx causing pain when swallowing. Adenoid hypertrophy, enlarged adenoids block airflow leading to mouth breathing. Dysphagia, difficulty swallowing when the pharynx cannot move food properly. Pharyngeal cancer can affect both breathing and swallowing, especially in smokers and alcohol users. Quick memory. N-O-L nasopharynx, oropharynx, laryngopharynx. Constrictors go top to bottom, superior, middle, inferior. 9 feels, 10 moves. Glossopharyngeal nerve, sensation. Vagus nerve, movement.